Hi, my name is Mustafa Hirji. I'm the Acting Medical Officer of Health for Niagara Region Public Health, and I'm joined here today with one of our infectious disease nurses, Sandra, at a safe physical distance.
Good morning, Dr. Hirji.
So we've received lots of questions around the possibility that you might interact with someone out there who has COVID-19 right now, and what are the measures that we're taking at Public Health to make sure that, if you have been in contact with someone who is a positive case of COVID-19, that you are protected. So first off, I just want to highlight that we're still seeing, of course, lots of other viruses going around in society. If you do get a respiratory illness, you have a cough, you have a fever, you have a runny nose, there's still a 90% chance that it's not COVID-19. But of course, that still means there's a 10% chance it could be COVID-19. So whenever someone is diagnosed with COVID-19, we in public health get the report that that person has been diagnosed, and it goes to a nurse like Sandra who follows up. So Sandra, can you tell us what you do once you get that report?
Yes, with each lab report that is received, we ensure the person who is diagnosed with COVID-19 is isolating and there's no risk of transmitting the infection to others. Next, we retrace the person's actions from the moment they become infectious to assess who they may have come into contact with and the nature of those interactions to identify everyone who might be at risk of infection.
So we've made sure that a person who actually is ill with COVID-19, they've been isolated, they can't spread that infection any further. And we found all the people who could possibly be infected. And so what are we doing with them?
So next, we would then follow up with each individual person that is identified as being at risk. And for most, the risk is low, and these individuals will be directed to monitor their symptoms for up to 2 weeks to ensure that they don't become infected. If an individual is identified as being at higher risk, they will be redirected to isolate themselves preemptively so there's no risk of spreading the virus if they happen to later develop illness.
Right, so if you have been in contact with someone who has COVID-19, someone like you is actually going to be reaching out to talk to them and advise them what their risk level is and what they need to do to protect themselves, protect their family and loved ones, and largely help to break this chain of transmission in society.
Correct.
So thank you so much for that explanation, Sandra. As I said, we are seeing respiratory viruses going around and we are seeing local circulation of COVID-19. So it's really important we do these things about keeping our physical distance, hand washing all the time to make sure we're stopping that chain of infection. And thanks to the great work of people like you, we're hopefully going to be able to follow up with every case and every contact to continue breaking that chain of infection. So thank you, Sandra.
Thank you.